And the central player in acne on our skin is Cutibacterium acnes. This used to be called Propionibacterium acnes, but in the 2010s, there was a nomenclature change, and now it's called C. acnes. C. acnes is an anaerobic bacteria. It lives deep within the pilosebaceous unit at the bottom of the pore, and it lives on the sebum. The fatty acids in the sebum are its primary carbon source. So it's really well adapted to live in the follicle. Now, although C. acnes is all over our body, it's particularly abundant in our sebaceous microbiome, which is the microbiome of our face, our upper chest, and our back. And coincidentally, that's where acne occurs as well. You don't get it in your knee or your torso, you get it in those areas. Further, C. acnes only colonizes in a major way at puberty. And so, for example, you don't see a lot of 6 or 8-year-olds with acne. And that's because at puberty, the hormonal changes result in the deepening of the pore, the production of more sebum, and these are ideal conditions for the C. acnes to grow and multiply. And when they overgrow, they cause acne. Now, the classic 4-step acne pathogenesis pathway is obviously well known to all of us. But I just want to highlight how this also encourages C. acnes overgrowth. So it starts with hyperkeratinization, which results in the closing of the pore and the creation of an anaerobic environment, followed by increased sebum production, which is food for the bacteria. And then this results in an accumulation and overgrowth of C. acnes, which through many very well understood molecular mechanisms, indirectly and directly, causes a lot of inflammation. Now, obviously, C. acnes growth is not the only part of acne. Acne is a multifactorial complex disease, and hormones are a big part of it, right? And hormones have a major effect on sebum production, both from at puberty when you have that hormonal flush, and that causes a huge number of changes, but also with hormonal acne, with adult acne, where the hormonal cycle dictates how much sebum production is going on. And that's why when sebum production increases, C. acnes overgrowth happens, and that cycle repeats. With diet, obviously diet is not a trigger for all kinds of acne, but when you do have a dietary trigger, whether it's spicy or oily foods or chocolate or whatever, these foods trigger an difference in sebum production and sebum quality, and this feeds the bacteria as well. Genetics is pretty easy to understand. People's pore sizes are different. People's, oily or dry skin are different. And this drives differential C. acnes growth. And finally, with stress, when you're sweating, when you're producing a lot of sebum, that encourages C. acnes growth as well. Now, the fact that C. acnes growth is a central part of acne is reflected in the fact that all or almost all acne actives are antibacterial in nature. Obviously, benzoyl peroxide is a strong oxidant, produces reactive oxygen species that are particularly deadly to an anaerobic bacterium. Antibiotics, it's pretty self-explanatory. They also have a mild anti-inflammatory effect. And retinoids target bacteria, especially C. acnes, by sebum production and anti-keratolytic action. And it's been shown that they actually differentially reduce C. acnes levels in a series of papers from the 80s. Now, Dr. Akintilo, you have a lot of experience with this kind of prescription medication. Would love to get your insights into what you see with, when prescribing these medications to your patients.
Of course. So as you mentioned earlier on in the talk, it is very important that we keep our microbiome in balance. And unfortunately, a lot of the medications that we're trained to reach for acne lead to an imbalance in the microbiome. And I think that's something that now we've learned exists on a cellular level, but our patients have told us in our clinics that, they can't really take antibiotics like doxycycline as a common culprit because it messes with their stomach. They get stomach upset, they get yeast infections. Some patients are not able to tolerate use of retinoids because it's too irritating. Their skin becomes really inflamed and sensitive. So a lot of us have had these experiences, and although they're tried and true, they do work. Some patients are just not good candidates. And one last point about antibiotics as a whole is that in the house of medicine, we're really trying to stay away from antibiotics. There's been a huge push about antibiotic stewardship and trying to minimize its use if absolutely not needed. So it is something that can be a challenge in the clinical practice for sure.
Yeah, and I want to echo that. I think the stats are that dermatologists prescribe antibiotics there's a specialty that prescribes antibiotics at a pretty high rate, and it is because it is something that's in your toolbox for acne. As antibiotic resistance levels increase, that becomes a particular concern for everybody, including dermatologists. But I want to highlight something you said and say that these products kill good and bad bacteria indiscriminately, right? And so I want to highlight the effect they have on the microbiome. The microbiome is, again, this layer that protects us and keeps us healthy. And when we use these products, particularly repeatedly, we are depleting or thinning out the microbiome, right? Think of it as if acne is caused by an invasive species in your protective rainforest, we are setting fire to this rainforest to try and get rid of the invasive species instead of going into the forest and just picking out the weeds and the invasive species and removing it. So, instead of setting fire to our microbiome every day, which results often in, you take a course of medication, you stop it, and then if you have a relapse, what's happening is your microbiome is not sort of resilient enough to resist another round of C. acnes overgrowth, and that's when you get that relapse. Instead, is there a way that we can preserve the microbiome and actually make it stronger and more resilient?